Teenagers are picking up nicotine vapes at an alarming rate. In 1 year, the number of 16 to 18-year-olds vaping has increased 75%. Today, Toronto's medical officer of health issued sweeping recommendations that could see vapes treated more like cigarettes and other traditional tobacco products.
And if we don't act as all three levels of government now, we risk undermining decades of effective tobacco control.
That from the chair of Toronto's Board of Health. Today, the Big Smoke's chief medical officer of health called on the city, province, and feds to prohibit the sale of flavored vaping products in retail stores accessible to minors and set a limit on available nicotine concentration.
Some of these products that are out there right now effectively deliver the amount of nicotine that you would get in a pack of cigarettes in a single pod or cartridge, which is often consumed within a couple of hours.
Toronto's Board of Health is expected to support the recommendations. Ontario's Minister of Health wasn't so quick to give her endorsement.
We are studying everything right now.
The recommendations also include banning advertisements in shops accessible to minors, like convenience stores or gas stations. As CityNews told you back in October, the province is already making that change starting January 1st. One of the big lingering issues is getting rid of flavored vape products. Today we found ads for sour apple, watermelon, berry, and more. Ontario's Minister of Health told us today she believes they're marketed directly at children.
I've also heard from people that have had to put their children as young as 14 years of age into rehab programs because they are addicted to nicotine.
The one vape store owner we spoke with today believes limiting the flavors will only lead smokers back to cigarettes.
Adults such as myself like fruits. Many people like cream, vanilla, mint, and that's how people quit cigarettes.
Toronto's medical officer of health says the data around vapes as a healthier alternative simply doesn't add up.
We're not seeing people switch over from tobacco to e-cigarettes, and rather what we're seeing is that kids who've never used either tobacco, traditional cigarettes, coming on to e-cigarettes and these other aerosolized liquid products.
Now, if the city, province, and feds were to implement these changes, it would still allow for flavored vapes and advertisements to be posted and sold inside vape-only stores, where minors aren't supposed to be allowed in, though some feel that could leave one big potential loophole.